And let me begin by expressing my sincere gratitude to the American people. Millions of Americans are making profound and difficult sacrifices in their own lives because they know it will save the lives of countless others, and that's exactly what it's doing. You see what's happening and where we are, where we stand, and hopefully we're going to be opening up. We can call it opening very, 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 very soon, I hope. Together, our people are writing one of the most noble chapters in the proud history of our nation. Americans are also encouraged to learn that Boris Johnson, Prime Minister, has been moved out of intensive care. That's a tremendous statement. And we continue to pray for him and his fast recovery. That's a very, very positive development. As the New York metropolitan area continues its battle against the outbreak, the full power of the federal government is there to support them. As you know, the Javits Center has now been fully converted into a 3,000-bed hospital, one of the largest anywhere in the country. And by the incredible professionals, I have to say the Corps of Engineers, what they can do is just incredible. They've done a fantastic job, and they're building nationwide 21 temporary hospitals and care facilities, adding 17,000 hospital beds. And they did that all within a very short period of time. It's incredible what they've done. Army Corps of Engineers and FEMA has been fantastic. Our sweeping airlift operation to keep doctors and nurses supplied with protective equipment, Project Airbridge, continues to expand with more than 24 flights already completed and 49 additional flights now scheduled in the near future. So that's been very successful, and that gear and those outfits are being handed out. As they arrive, they're going directly to point. The American medical system continues to perform beyond our highest expectations, reminding us that the United States is blessed with the most advanced health care and the most skilled healthcare workers anywhere on the planet. Other countries are looking to what we're doing, and our testing operation has now become far and away the most sophisticated and the best anywhere. And we want to thank all of the heroes on the front lines as they fight to save American lives. We're at the top of the hill, pretty sure we're at the top of the hill, and now we're going downward. In some cases, we've already started that process. Earlier today, I spoke with hundreds of mental health leaders and advocates from around the country to discuss the vital work they're doing. We had the top doctors in the country, some international doctors. Mental health, big factor. Not only has the virus inflicted immense physical suffering on many people, but also mental and emotional suffering as well. Even though we're staying physically apart, no American is alone, and we're all in this together. But the mental health doctors and experts, it's a very great call. It was a very interesting call. They're working very hard. We're also seeing encouraging signs in our race to develop breakthrough treatments and therapies. Pfizer revealed today that it has found a promising new treatment that might prevent the virus from replicating, and that it hopes to begin testing in clinical trials very soon. It's going to be very, very soon. They have great feelings for this particular therapy, and they think that a lot of good things are happening through the FDA's Coronavirus Treatment Acceleration Program. 19 therapies and treatments are now being tested, and 26 more are in the active planning or clinical trials. So we have 19 therapies being tested currently, and 26 more are in the active planning for clinical trials. That's a big statement. That's a lot. Trials for Gilead's anti-rival drug remdesivir continue, and the company has also expanded emergency use for new patients, getting good early results, by the way. The companies that manufacture hydroxychloroquine are massively ramping up production. As you know, many people are recommending strongly Z-Pak be added, the Z-Pak, and also zinc. And the federal government continues to build our stockpiles and distribute millions of doses for doctors to use as they see fit. And I'm pleased to inform you we're just having a lot of good things are happening, but we'll have to see how that all works out. But we've purchased and we have stockpiled millions and millions of doses, and We're distributing it. Some states want it very badly. Michigan, we just sent a lot to Michigan and other areas. I'm reporting today that we passed 2 million tests completed in the United States, first time. Most anywhere in the country. It's a milestone for our country. It's a milestone anywhere. Nobody's done anywhere close. Our tests are highly sophisticated and highly accurate. At the same time, we're making important progress on the economic front of this war. In a few moments, Secretary of Labor Eugene Scalia will explain new steps that we're taking to ensure American workers swiftly receive unemployment and paid leave benefits, and that employers protect the health and safety of all workers, including essential workers on the job, working very, very closely with workers and with employers. To provide further economic relief, the Federal Reserve announced this morning that it will provide up to $2.3 trillion in support to businesses, states, and local governments. $600 billion in loans will be available for mid-sized businesses with up to 10,000 employees, and $500 billion will be available for states, counties with over 2 million residents, and cities with a population of over 1 million. My administration is also working with Congress to replenish the very successful, incredibly successful, the way it's going, Paycheck Protection Program, which is allowing hundreds of thousands of small businesses to keep their workers on the payroll, meaning it'll keep those businesses open. We need both Democrats and Republicans to come together to get this the legislation completed, and it looks like it's on its way, but we need both. And it should be for people that are working, for the workers. And if you look and you see, we have a lot of people that are affected by that, and it's a very positive development. So we have to get a bipartisan approval of that, and hopefully that'll happen today. The Department of Education is also announcing the availability of more than $6 billion in emergency grant funding to assist college students impacted by the cancellation of classes and the suspension of housing. A lot of people had a lot of things suspended. Housing is one of them. Previously, we waived student loan payments for 6 months. So student loan payments have been waived for 6 months. So we'll discuss it after that. May go further. Although this medical war has separated our citizens for a period of time, it's also united our entire nation. I think I can say, like almost never before, Americans are moving forward with common purpose and shared resolve, determined to vanquish the virus and lift our nation to even greater heights. We are supremely confident in the magnificent future that awaits the American people.
The other thing that's some just broad general good news from the standpoint of a scientific standpoint, that there are a lot of candidate potential therapeutics that are going into clinical trials now that we're sponsoring at the NIH, the kinds of clinical trials that will give us the answer. Are they safe? Are they effective? And just what is the capability of using them under what circumstances, as prophylaxis, as treatment, in early disease, in late disease. So as the time goes by and we have the public health measures to try and contain this, we're doing an awful lot from a scientific standpoint so that when we do get to next year, next fall, next winter, hopefully we'll have something that we can offer in addition to the very important public health measures. So I'll be happy to answer questions later.
Mr. Secretary.
Mr. Vice President, thank you, and thanks to the task force, and of course thanks to the President for his leadership. The important public health measures that have been discussed so much in these briefings in this room have had a large impact in American workplaces. We saw that again today as the Labor Department released figures showing that 6.6 million new unemployment claims were filed last week. We're all mindful, the President mentioned this, that the American people are making difficult sacrifices. That has included being furloughed, laid off, or having a small business struggle. That said, American workers can be encouraged by how swiftly and comprehensively the President and Congress have responded. 3 weeks ago, the U.S. had never had a law requiring paid sick leave at U.S. companies. But 3 weeks ago, the President signed the Families First Coronavirus Response Act, which did provide paid sick leave, as well as expanded family and medical leave for employees at small businesses, with those small businesses being reimbursed dollar for dollar for having provided that leave. Last week, we at the Labor Department issued rules to implement these leave requirements of the Families First Act, and we've been in near constant contact with employers and employees to help them understand the law, and in a number of cases already, to help workers get the leave that they were entitled to. Another unprecedented benefit for workers was provided in the CARES Act less than 2 weeks ago. That law, as you know, includes a $600 a week plus-up to unemployment benefits that are provided by the states. We have millions of unemployed Americans who are making a sacrifice for our national well-being. These bonus payments, and they're unprecedented, the government has never provided a plus-up unemployment payment like this. These payments are intended to make those workers whole as near we can. This temporary benefit is available not just to employees, but also to the self-employed and gig economy workers. Before the President signed the CARES Act, gig workers, independent contractors were not available for unemployment compensation. Today they are. At the Department, our team has worked day and night to enable states to make this benefit available. I'm pleased that a number of states are now making those $600 additional weekly payments. More states will follow in the.
So I wanted to cover today not only what we're seeing across the United States, but some of the testing data to assure from the prior question, if we're testing, I'm sure you're following our numbers every day, and the amount we're going up, about 118,000 to 120,000 per day are being tested. So we're way over the 750,000 per week currently. We have some statistics. Now, remember, we required this, thanks to Congress, to be reported. We have about 75% of that test data in now. About 1.5 million of those tests have been reported in. I just wanted to give you some ideas because sometimes we think that we're only testing in the hospitals, that this should give you an idea of the quantity and the types of tests that have occurred. So we've tested over 200,000 young people up to age 25. They have about 11% positivity rate. Over 500,000 people between 25 and 45. They have a 17% positive rate. Now remember, in order to get tested, you have to have symptoms. So this gives you an idea of the number of people who have symptoms that are not infected with coronavirus. Another nearly 500,000 people between 45 and 65, their positivity rate is 21%. Another nearly 200,000 between 65 and 85, 22% positive, and a small group of about 30+ thousand individuals over 85, and they have a 24% positivity rate. And so this gives you an idea of we're testing throughout all age categories. I see a lot of men in the audience today. I just want to remind them about the importance of health care. Of the male-female ratio, 56% of the people who are tested are female, 16% positive, 44% male, 23% positive. So again, it gives you an idea about how men often don't present in the healthcare delivery system until they have greater symptomatology. This is to all of our men out there, no matter what age group. If you have symptoms, you should be tested and make sure that you are tested. We appreciate you engaging in that, and also really recognizing the issues about comorbidities and making sure that we're addressing those. I had a series of great calls with about 17 states that are in our more rural areas, specifically around our indigenous people and tribal nations. It was a very reassuring call, and we are testing across the country. We do have about 63% of states that have less than 10% positive despite significant testing. And within the indigenous peoples and tribal nations, they're seeing the same thing that we're seeing across the nation. Increased issues among those with comorbidities and those of elderly, but also issues in nursing homes. And so they are testing, many of these states are still capable of doing full contact tracing. And so they've been doing contact tracing from nursing home outbreaks and other outbreaks. It really gives us a clear impression of no matter what we do in the future, we need to really ensure that nursing homes have sentinel surveillance. And what do I mean by that? That we're actively testing in nursing homes both the residents and the workers at all times. That is where, and that's how we saw this at the beginning. That's what we saw in Washington State. And that's what we're seeing in many of the states that have very low case attack rates. The other thing that I want to leave you with, I mean, we certainly know how desperate and difficult the situation has been in New York over the last few weeks. And we've been telling and talking about how this would be the week that would be most difficult because of the large proportion of cases that are coming from the New York metro area. What's been encouraging to us, those early states outside of Washington and California, which still have extraordinarily low attack rates because of their level of mitigation, all of the new areas that are having new increasing cases, we talked about them yesterday, Washington and Baltimore and the Philadelphia metro area. That includes Camden, Wilmington, and the counties around Philadelphia. We're seeing that the case numbers, what we'll get to as far as attack rates, we talked about 1 in 7 in 1,000 in New York that are being measured. These are coming in, even with their progress up their curve, in the 1 to 2 per 1,000 range, showing that when you start mitigation early, it has a very different impact. All of this data is coming together, the testing rates, the seropositivity, the age groups, who really needs hospitalization, ICU, the innovative pieces coming from, we heard a great report from Louisiana this morning on the phone call where they talked about a minimum now of 40% of people coming off of ventilators alive and leaving the hospital. This is very encouraging to us. Really shows amazing progress clinically at each of these hospitals and the real lessons what we're learning and sharing across hospitals. But really shows us that the original outbreaks were very large, but the newer ones that we talk about in Washington and Philadelphia and Baltimore, it looks like their attack rates and the attack rates in Denver and some of these other states that we have been talking about are much lower than New York and New Jersey. And this gives us hope about really understanding how to integrate this information together, not dealing with a model, but the real life cases that are occurring and understanding how to move forward together to really have a different future. So thank you very much.
Thank you very much, Mr. Vice President. So just reflecting about what we've been doing over the last few days, remember last weekend when we made the forecast that this would really be a bad week? As I mentioned yesterday and the day before, it is, in the sense of deaths, a bad week. In fact, every day there seems to be a record of number of deaths compared to the day before. In fact, New York today had, again, another record of, I think the city itself was about 820 plus deaths. But what we were predicting with the increase and the real adherence to the physical separation, the guidelines that the Vice President talks about, the physical separation, at the same time as we're seeing the increase in deaths, we're seeing rather dramatic decrease in the need for hospitalizations. Like I think yesterday was something like 200 new hospitalizations, and it's been as high as 1,400.